Hello and welcome to my health channel. My name is Dr. Shanay, and in my channel I'll be covering certain diseases and certain common diseases which are found in the society, and I'll explain you the exact reasons why these diseases are acquired by the human beings, and how to avoid certain diseases and whether certain diseases can be avoided at all. I'll be using easy terms so that easily you can understand what I'm talking about. I'll not be using high terms, and I'll be using less pictures as possible because most of the times the pictures give very scary image and impression about certain diseases. So in this particular today's episode, I'll be covering a little about oral cancer, or what is called as mouth cancer. So mouth cancer is one of the scariest diseases uh, in the opinion of the society, and most of the times where it's easily recognizable disease, because it can be directly seen, like a skin cancer. The oral cancer also can be seen very easily and can be identified. Oral cancer, as the name suggests, it means mouth cancer. What happens within the mouth, up to the throat, So that's all covered, right from the lips, the gums, the tongue, the floor of the tongue, that is the area below the tongue, roof of the mouth, that is called as the palate, particularly the front part of the palate, and a bit about a bit of throat, and the region behind, we call it as retromolar region. That is the region behind the last lower tooth. So that is called as the retromolar area. Particularly, that is very important area, and also some areas like tonsils and pharynx. So these are covered in the mouth cancer or the oral cancer. Oral means in the mouth. So oral cavity we call it as. So what happens within the mouth? So that is called as oral. So I'll be talking about those kind of cancers. So first of all, we should know what is a cancer. So cancer is nothing but it's abnormal proliferation of the cells. So daily thousands and thousands of cells die, and thousands and thousands of cells are reborn. New cells are formed within the body. So cells are very important for the functioning of so many things, which we'll cover in the later chapters sometime. So if these cells divide, and they become too many cells, that is the proliferation means, the multiplication of the cells become too much, uncontrollable, and it goes beyond certain limits, it can form cancer. Means, for example, 10 cells die, 10 cells have to be reborn. So but here there is a difference. 10 cells die, but around 1000 cells form, in compensation. So that is very dangerous. So then it is called as mostly it is cancer most of the times. So in simple terms, I am telling, in layman terms. So cells die and equal number of cells are not formed, but abnormal number of cells are formed. So the multiplication is too much. So that is called as cancer. In cancer, there are, we call it it's called as malignancy. So malignant tumor or malignancy. The tumors are of two types. One is malignant, that's a cancer essentially, and another is called as benign. Benign means not harmful. It's benign in nature. It's softer in nature. It's not very harmful. It can be easily treated. Those are called as benign, and malignant are cancers. So in cancer there are two types. One is called as carcinoma. Another is called as sarcoma. Carcinoma is usually found in epithelial cells, like say over the skin, the mucous membrane, the lining within the gullet, in the esophagus, and throat or body, wherever there is a lining of epithelium or the mucous membrane. So those tissues only are covered in carcinomas. Means carcinomas happen in those kind of tissues, epithelial tissues, we can call it as, wherever epithelium is found. Epithelium is a layer like a skin, and within the mouth it's called as mucous membrane, and that continues in the throat, and it goes into the stomach and entire the intestine, up to the end of the intestine. So those are all covered in the epithelial malignancies, those are called as carcinomas. Sarcomas are essentially connective tissue types, and mesenchymal tissues we call it as in our terms. In medical terms, we call it as mesenchymal tissue. So it's a cancer of that. So sarcomas are essentially connective tissues like bones, this, that, muscles, and those kind of things. Those are covered under sarcoma. So carcinoma, we are talking about oral carcinoma today, or the mouth cancer. Okay, so those are the oral tissues which you can see with the naked eye. You can see. I open the mouth, and if I have the cancer, I can see. So a dentist can see. So oral carcinomas usually are identified by the dentist because they look into the oral cavity always. So in the oral cavity, what's happening in the oral tissues, the teeth, everything they examine, right? So they can find out very easily the oral carcinomas. That's why it's important for a person to go to a dentist at least once in 6 months, not to find if there is any cancer, just for a dental checkup. At that time, if there is a cancerous tissue or precancerous tissue, there is a preluding, episodes of cancer, they can easily find out. And also it can be found out by the ENT surgeons, because ENT people look into the throat, right? They examine the throat most of the times if there is any throat problem. So they also can identify very easily. So these are the two categories of specialists who can identify a cancer, oral cancer very easily, mouth cancer very easily. So how one gets oral cancer? See, all the cancers, they usually are these particular epithelial carcinomas, these are usually the results of chronic irritation. Chronic irritation means long-term irritation to particular tissue. They cause sudden proliferation of the tissues, and it's a body reaction to the particularly to that irritation. Okay, so what are the irritants we are exposed to in the mouth? Number one, smoking. So if a person is a chronic smoker, they smoke beyond a certain limit, chain smokers we call it as. Such people are likely to get this kind of a problem. Not all over the mouth. So a particular part of the mouth is exposed more to this smoke, and also the heat generated by the smoking. So the irritation, chronic irritation, can cause carcinoma, oral carcinoma, or the oral cancer. It can cause smoking. Another reason is called as sepsis. Sepsis, dirty gums. There's a lot of calculus formation around the teeth, which irritates the gums. They can cause carcinoma of the gingival tissue. Gingival tissue means gums. Gingiva is gums surrounding the teeth, supporting structure. So that comes in the epithelial region, right? So that can have cancer. Okay, though not very frequent, we do find such cases. Or this kind of a sepsis can cause carcinoma anywhere in the mouth, for that matter. Sepsis and spirit, alcohol. Okay, alcohol. I'm telling all the words starting with the S. We call it as the S factors in oral cancer. Third one is spirit. There is excessive consumption of alcohol, particularly without much of dilution. Some people drink alcohol neat. You call it as just they add some ice and they just drink. And some people have the habit of rolling the alcohol within the mouth to get the taste and then gulp it. This rolling for a long time, it can cause irritation. It can cause irritation to the certain tissues of the mouth. It can turn into cancer in the future. We don't know. Okay. Then syphilis. Syphilis is a contagious. It's a sexually transmitted disease. We call it as. So certain forms of syphilis, they can turn into cancerous lesions. Okay. So there's one more reason, and so these are the S factors we call it as. And then the spicy food. So some people have the habit of eating the spicy food daily, on a daily basis. They directly eat chilies also, directly. Such people are likely to get irritation to the tissues. Then this irritation can turn into cancer, can turn the tissues into cancerous tissue. It can, cause. Then the sharp edges like teeth, certain teeth have got the sharp edges. They wear out, and then the sides will become sharp, or the teeth break. Some teeth break sometimes while eating very hard food, and it will leave the sharp edges. The sharp edges, particularly tongue, it can irritate the tongue. So most of the cancer of the tongue, what we see, is because of the sharp edges of the teeth. Unfortunately, it is so easily treatable, these sharp edges of the teeth. They have just go to the dentist and say, I got the sharp edges, or please examine my teeth, to see if there are any sharp edges. The dentist will find out and they just round it off. So those kind of things, then those kind of measures can really, prevent this serious disease, right? Just rounding off the sharp edges of the teeth. And sharp edges on the outer surface of the teeth, we call it the buccal side or the labial side. Labial means toward the lip, buccal means toward the cheek. They can cause irritation and they can cause cancer. So these are called as S factors, we call it as. And also the ill-fitting dentures. Certain people have got the artificial teeth, the dentures with the flange, the base, acrylic base, and also. So those become too old. They don't go for a change of that. They have to get it changed once in a few years, say 4 or 5 years. They don't go back. They think it's permanent. So those can be ill-fitting. They can rock, and they can cause irritation to the tissues, and this irritation can turn into cancer. Oral mouth cancer, it can. Okay. So these are, say, most of the oral cancers are preventable. Most of the mouth cancer, they are actually preventable. So provided the person takes care of all these things, chronic irritation. Okay. But sometimes they don't know that the things is irritated. Because the irritation is not felt. They're used to the thing so much that the irritation is not felt, right? So that so what I'm saying, don't eat too much of spicy food on a daily basis. Okay? Rinse your mouth immediately after eating the spicy food. Don't allow the spices to remain in the mouth for a long time. Rinse the mouth frequently. Said that rinsing the mouth frequently itself will reduce irritation, right? And also, if the dentures are not, if you have any processes, if they are rocking and all that, get it corrected. Get a new denture made. Okay? And if the sharp teeth are there, get them blunted, get them rounded off by the dentist. Have a checkup from the dentist once in 6 months and ask if anything is happening. Okay. All right. So a person, say before certain tissues turn into cancerous tissue, it goes through a stage called as a precancerous stage. Precancerous stage means the patient goes to the dentist or to ENT surgeon, so they examine the tissues and they suddenly find a white patch or a red dot or something, or they find an ulcer, a patch or a dot, turning into an ulcer. See, an ulcer which does not heal for 2 weeks or more, they can be precancerous or it can be cancer. An ulcer is within the mouth which doesn't heal at all. An ulcer should heal usually within a week, maximum 2 weeks. If it doesn't, everybody gets ulcers, right? Stress ulcers, this ulcer, that ulcer. So everybody gets ulcers. If the ulcers don't heal for more than a week or 10 days or 2 weeks, then they have to go for a checkup and ask, what is the reason it's not healing, and is it something else? So it can be precancerous or it can be cancerous. Precancerous means it has not turned into cancer yet, but it's on the way to turn into cancer. Those are called precancerous lesions. In the precancerous types, there are certain categories, something like erythroplakia, means a reddish, rough patches, or white patches. We call it the leukoplakia. Leuko means white. Erythro means reddish. Okay. So erythroplakia or leukoplakia, so we call them as, these patches can turn into precancerous and then it can turn into cancer. A person can feel them with the tongue easily. Just swirl the tongue, along the tissues. If you encounter a rough patch, go to a dentist or go to a ENT and get it checked up to see if it means anything, anything dangerous. It's so easy. So these are called the precancerous stages of oral cancer or the mouth cancer. Say, understand one thing. These epithelial cancers, particularly on the skin, anywhere on the skin cancer, and also the oral tissues. It can be easily seen. It can be easily seen by the doctor. It's not like other cancers which are happening after the throat area and within the gullet and other regions, other internal organs, where the cancer may develop, but it may not give any signs, and it is not visible. So only when it goes to the next stage or some third stage or fourth stage, then only it swells. So because of the pain and certain things, certain abnormal happenings, then the doctor suggests the patients to certain tests and all that, then it's known that it's a cancer, right? But here it can be seen easily, right? So you have the chances of avoiding oral cancer or the mouth cancer. You can easily avoid if screening is done at least once in 6 months. So it's very important to go to your dentist and get the teeth checked up, teeth cleaned up, and also have a general checkup of the tissues, or go to a ENT surgeon. Okay, they also can identify this mouth cancer. Okay. So how long it takes for the tissue to turn into cancer? It cannot be gauged, and it's very quickly also it can turn in, but usually it takes months or years after chronic irritation. If it continues for months or years, then only usually it turns into cancer. But in some cases, we have the reports of tissues turning into cancerous tissue very, very fast, within a few months. It can happen that way also. And particularly this mouth cancer is more in India because of certain habits like eating gutka and pan masala, we call it as. So the Doctors Association has given representation to the government to ban these products. And also the chewing tobacco. It can irritate the tissues like anything, and that irritation is not felt. No, it's enjoyed by the person. So if taking trade name, pan masala, okay, and also the chewing tobacco for a long time, the tissues can turn into fibrous tissue. Fibrosis can take place, means hardening of the tissue. If you feel it with the tongue, that particular area will feel very hard. Okay, and it may reach a stage where the person cannot open the mouth properly. The tissues become so hard, and these hard tissues can turn into cancerous tissue in the future. So all these things should be stopped, and the government should ban all these things. Certain things, there are restrictions are coming up by the request of the doctors' associations. Particularly in India, this oral cancer incidence is too much. 1 in 3 cases out of 10, that is directly around 30% of the cases are mouth cancers in India. So it's because of all these problems. Okay. So now when the cancer can become dangerous, see, the cancer when identified, when it's properly grown cancer, it shows as an ulcer, or it shows as a growth or a crust, just as a crust, an elevated. I'm not showing any pictures purposely because it can scare you. Okay, I'm not using any pictures. I'm telling you how it can look. It can look like a crust, or it can look like a ulcer, which may not pain, or it may bleed, but it may not pain, or it can be a little painful. It depends on where it is. Suppose it's on the tonsils, it will definitely pain. Some areas it doesn't pain at all. It may bleed. The bleeding is continuous. It doesn't stop, and the bleeding is not profuse. It's little bleeding. So all these things can be cancer, or it can be solid swelling of the tissue, which doesn't go down. Ulcer which does not heal. Swelling which does not go down. Okay, so all this can be cancer, or it may not be also. It may be something else. Okay, there are a lot of other conditions which mimic, which looks like cancer, but so always you should not get scared. So take it cool, go to a dentist or oral surgeon or ENT and ask, what can be done about this. They will do certain tests. So what tests are done usually? So they usually scrap the tissue a little, exfoliate to cytology, we call it is, and they just scrap it and they send to the lab to scrap portion, and abnormal types of cells are reported back by the lab. Cancer type it is. Then they take a biopsy. Biopsy means small piece, a very small piece, and they remove by the blade, the surgical blade. They'll anesthetize properly and then they'll take, and they'll send it to the lab for biopsy, fixation, and they'll get the report. Then it's confirmed that it's cancer or not. Okay. Certain radiographs or certain x-rays may be required if the cancer has gone invaded inside. It has gone inside, okay, to the bony area, and it can turn into something else. Okay. And when cancers are really dangerous, see, when it's localized to area, patient is safe. Okay, when it's localized to area, means it is not spread beyond that area, it has not gone anywhere. But certain cases where it has gone to the advanced stages, what happens is, more than within the mouth, it has gone to the other parts of the body. Means it has metastasized. Metastasis has taken place. Metastasis means it has gone beyond from its site. It has gone to other areas and it is spread all over the body. You get it. So entire stomach may be invaded, the intestine may be invaded. That is a scary picture. The metastasis, if it takes place, it's really difficult. It's the last stage of the cancer. It is very difficult to treat. It's very difficult to treat. Okay. So what are the treatments available for the cancer? How a cancer oral cancer or mouth cancer can be treated? Number one, excision. Excision means, so by surgical procedure, remove that region. Okay, suppose it has invaded the tongue, remove one half of the tongue, that invaded side, or sometimes total glossectomy, call it as. Glossectomy means removal of the tongue itself, entire removal of the tongue. Then processes will be fabricated. Artificial tongue can be fabricated later by the particular specialist. This is quite scary, right? If it's cheek, the entire cheek portion may be removed. Okay, so those are all excisions, we call it as surgery. Surgery is number one. Okay, if it is a small area, good, a small surgery is done. Then the radiation. Radiation means a particular irradiation, a particular amount of irradiation is done. Radiation is done. So suppose it's on one side. Suppose any treatment has to be given to the teeth. It is done first, because after the irradiation, what happens? Within in that area, the blood vessels will die. Smaller blood vessels, micro circulation will stop. So it takes around 6 months to 1 year for the blood circulation to get restored properly. So within that period, if any serious dental surgery procedure is done, the tissue may undergo necrosis. Necrosis means death of the tissue. Okay, which is very dangerous. That's why all the dental procedure, if anything has to be done, those procedures are done before the irradiation. Then the irradiation is done. After the irradiation for a year, nothing is done. Nothing else should be done. Okay, irradiation it will just literally burn the tissue. It will literally burn the tissue. Okay, so that is another step. Or the patient may be put under immunotherapy, particularly if it is metastasized. It means if the cancer is spread to the other part of the body, immunotherapy may be required. Means boosting the immunity of the patient to prevent further problems, and so that patient can lead at least a bit of a quality life till the patient survives. But survival rate comes down and down by that particular time when the patient reaches that stage. So here in medical terms, we call it as a 5 years survival rate. After cancer is identified, whether the patient will be able to live for the next 5 years. So that way it is calculated usually, the survival rate, any cancer. For example, it's in the multiples of 5 usually. Now, for example, if it is in stage 1 cancer, we call it as, we say, okay, the patient may live for, according to statistics, may live for another 20 years. 5 into 4 times, more chances of the patient surviving. That 5 year survival rate goes into 4 times. Okay, so in that way it is usually calculated. And when it is metastasized, the 5 year survival rate is very, very bleak. It is very, very less chance of the patient surviving beyond certain few months sometimes. But still, the hope should not be lost, and the specialist may subject the patient to Immunotherapy means boosting the immunity so that further damage is they try to prevent. And also because a patient has to everybody has got the right to lead the life, right? As much as possible improve the quality of the life. And also palliative therapy. Palliative therapy means to bring down the pain. See, once the metastasis has taken place, it can be really painful in different organs and all that. The thing can be really painful, actually. So bring down the pain of the patient. That is called as palliative therapy, or symptomatic therapy. We call it as far as the person lives. Okay. And one more thing I forgot to tell you. In most of the cancers, what happens is there are certain lymph glands, we call it, as here, here. So there are certain lymph glands, which a patient will not be able to identify properly. Only certain glands they can feel here directly. Glands are available for touch. Suppose there is a cancer of the floor of the tongue, floor of the mouth, we call it as below the tongue. Immediately these glands will swell up. See, glands, these lymph glands are nothing but they're the drainage systems. They drain, the wastage and all that. They send to the drainage system. So those are called the lymph glands. So the lymph glands will start swelling up, that particular area. So lymph glands are an indicator of something happening, always. It can be a small infection also. For example, if the person gets tonsillitis, he can get the lymph node enlargement, because basically these lymph nodes will respond to any kind of small infection also. Okay, or it can be more serious, something more serious than the cancer itself. Okay, so those are all the doctor will do all those examinations, of course. They'll not worry about that, but these are all indicators of something happening. Okay, so that more checkups are required. These are the indicators. So I told you about the mouth cancer, about carcinoma, and what is the sarcoma, and what is the difference between the benign tumor and the malignant tumor. Malignant means cancer, and how to stay clear of because mouth cancer is one of the easiest to prevent, but one of the most prevalent in the society. Unfortunately, it's one of the most prevalent, and which is easy to identify. That's the irony of it. So it's not like other cancers which are hidden. So this is not hidden. One can see, and it can be prevented so easily. So your near and dear ones, everybody should stay clear of these kind of problems. Go for a checkup at least once in 6 months and see if any abnormal things are happening within the mouth. That is the only way of avoiding the mouth cancer. All the best. I'll meet you in the next episode.